Welcome to our Champion Learning Portal. Now, Dr. Radhakrishnan will help us with everything we need to know about varicose veins. Let's start.
Varicose vein is. So usually, when you have a varicose veins in the legs, the blood is not getting back to your heart because the valves in the veins are not closing. Okay, so that's a very important thing is happening in your leg because the blood goes good if you have a good circulation, because you don't have any problem with the blood flow down, but it's the problem with the blood flow up. It's the circulation is the issue. Okay, when your blood does not circulate properly, you have less oxygen to your legs, and you feel cramping, heaviness. Some people have itching, restless legs in the leg, and they may feel very tired at the end of the day. And ankles can swell, it can cause a lot of problems in the leg. Okay, so the first treatment is putting that stockings. So that's the reason, but it's only like a temporary, like a band-aid, putting a band-aid on your leg. Okay, so you have like a multiple stages. So you have zero. Zero means like no veins you can see, but you have 1, 2, 3, 4. Fourth stage is the worst stage where you can have the pigments coming in. And stage 6, you can have an ulcer. Okay, but good thing that you are in a better stage. Okay. So the treatment is very, very simple. It takes me about 10 to 15 minutes to fix the vein, and it's not a surgery. Okay, it's just a procedure we do routinely here, and you can drive in and drive out. You don't need to bring anyone unless you're afraid. You can bring someone with you. Okay, otherwise you can come in. Most people can go back to work the same day, so you can go back to work. That you don't need to take a day off. But
I'm retired.
Okay, so that's good. I would like to be retired as well, but
you will one day.
So the first thing is, what I do is I get you have 4 veins in your legs which are not really carrying the blood back to your heart. Okay, which has the problem with your valves. So what we do is, I seal the bad vein and reroute the blood through the normal veins, because we have so many veins in the legs, but only 2 veins are involved in one leg, okay, and 2 on the right leg. So we have so those are the 2 veins which are not really doing its job of carrying the blood to your heart. Okay, so what I do is I get an IV in that vein, get you some numbing medicine, just like a dentist give you. It's an office procedure. Okay, once I numb the leg, you don't feel anything. Then I seal the vein. Okay, so we usually use two kinds. One is called radio frequency or laser. We use radio frequency, which is less painful. Okay, but once I give you the numbing, you don't feel any pain. But numbing you're going to feel it.
Oh yes.
Yeah. Okay, and it takes me about 15 minutes. Usually I'll be done in 5 to 10 minutes. Okay, and you walk back home. But the nurses will take time to get you a consent signed, clean your leg, prep. Those takes about an hour. So you are going to be spending 1 to 2 hours in the office, but my procedure itself is very, very short. You're done and you walk back home. They will wrap your leg after that. So you put that wrap for 2 days. Then you can remove the next day. Okay. So they will put for you. So you don't have to worry about putting the stockings.
In other words, that procedure is going to get my blood flowing back to my heart like it should.
Correct. Much faster. And you'll feel a lot of energy in your legs after I do this.
Is it going to give me some energy?
Definitely. In your legs, it will give you more energy because now the blood is flowing faster through the normal veins. Okay. And the one thing you cannot do is you cannot fly for 1 week. Okay.
I can't walk.
You cannot fly. If you're having a private chopper or private flight, don't do the piloting. Okay. So no flight and no driving more than 4 hours at a stretch. Okay. 1 week. Okay. So you have 4 veins. We don't do all 4 veins on one day. We do 1 vein at a time. So you need to come 1 vein, then the next week other vein. So we do 4 times. There's no, we wanted to make sure that, we do only 1, and if there's a complication or something, we take care of only 1 complication, not like 4 different ones. Okay. But it's very, very rare. So usually, that's the reason we do an ultrasound to see if the vein is sealed within a week. When I fix it, you come back to check it out. if the job that we did really work or not. So there's a 95% chance it will close. It's very rare it opens. Okay.
Okay.
Any other questions?
I got you. I understand exactly what you're saying.
Good.
And once we get through with both legs, I should feel a big difference.
You'll even start feeling a big difference even with the one vein. So once we start second vein, you will come back again to do more because you're going to feel not much better. So once we fix your left leg will feel a lot better than the right leg. Then, we have to complete it. Okay. So it's a very simple procedure. We do this routinely like a clinic visit. So, as I said, you can come yourself, you can drive yourself in, you can drive yourself out. No need to take a day off. And it's no downtime for you. Okay.
I got you.
Okay.
Hope you liked our detailed varicose veins treatment tutorial. If you have any doubt or question, please let us know in the comments or reach out on the contact page of championhealthsystem.com. Thanks for being a part.